Welcome to the Education Research Basics module about when and how to work with a statistician. My name is Karen Schlumpf, and in this session, we will identify important things to know when working with a statistician for a research project. First and foremost, a research project is a collaboration that involves multiple team members. Everyone on the team contributes their knowledge or expertise on the final product, including the statistician. So when is the right time to work with a statistician? There are several points along the research path when a statistician can provide analytical help. Meeting with and establishing that relationship early in the process is best. Talk often, even if it is just for a quick update. Most importantly, do not wait until the last minute to consult with a statistician. What should you know before you meet with that statistician for the first time? I can't stress enough the importance of having a solid knowledge of the literature. You are the expert. Statisticians work on multiple projects and are relying on you to provide them with that literature background. With your knowledge grounded in the literature, you should then know what you want to study and the research question guiding your work. In addition, be sure that you have a rough outline of your research study, including the study population, the study site, and the data collection tools that you plan to use. When you establish that relationship with a statistician, plan to discuss the following. First, be sure that you know what the statistician's consulting fees are. Is it based on an hourly rate, or will they give you a flat rate for the entire project? Secondly, be sure to share your timeline and budget constraints. The timeline is particularly important, and together you should map out the different milestones for deliverables, such as grants and publications, as well as the points along the way when certain analyses are needed. Also, it's important to set specific responsibilities regarding the data. How much data needs to be cleaned, who's going to clean it, and when that data is needed for the data analysis. Also, it's important to talk about expectations regarding publications. Does the statistician want to be part of the authors list? Are they going to contribute to writing different sections of the publication? Are they going to be helping to develop different tables and figures? And finally, it's always good to have this in writing so that you can refer to it at any time throughout the life of the project. So what can you expect when you first meet with your statistician to talk about your project? Statisticians need several key pieces of information to help determine the right analysis plan for you. Perhaps the two most important components of a data analysis for a study are the hypotheses and the variables. There is no one-size-fits-all in statistical tests, and it is the hypothesis and variables that determine the appropriate test to do. First, the hypothesis establishes the type of relationship that we want to explore. Is it going to be a comparison of 2 or 3 or 4 groups? Are we looking at a prediction or an estimation of an outcome? Or are we just simply looking at the association between 2 variables? The hypothesis itself will help clarify the type of relationship that we want to test. Secondly, the variables themselves help dictate the type of analysis we want to conduct. Statisticians will work with you to identify the dependent and the independent variables involved in your analysis. Also, it's important to recognize the type of data that these variables represent. How were they measured? This is particularly important early in the process so that the statisticians can help you choose the right data collection tool. Statisticians will also want to know information regarding your study sample. Perhaps the most common role that statisticians play in health research, particularly for clinical trials, is generating a sample size estimations. In order to do this, statisticians will ask several questions. First of all, they want to know what's your main hypothesis. What is the relationship that you want to study? Secondly, a statistician will ask whether or not there are groups in the study. Are you looking at treatment versus control, or 3 or 4 different study groups? Third, a key component of a sample size estimation is knowing what effect size you plan to measure. This is sometimes referred to as minimal detectable difference. This is where your knowledge of the literature will be particularly important when working with your statistician. Is there some sort of information available in the literature that talks about the minimal detectable difference? Do we have pilot data available to us? If not, the statistician might need to use an approximate value of effect size for their sample size calculations. Finally, it's important that you provide the statistician with information regarding any limitations for recruitment. What is the budgetary and timeline constraints for recruiting study subjects? In closing, working with a statistician is a team effort. Be careful of common pitfalls. Don't wait until the last minute to consult with a statistician. Asking for a sample size calculation the night before a grant is due is too late. Having the statistician involved before the data is collected will help you make sure that you have the right data to answer your question. Secondly, be sure to set a timeline, not only of the written deliverables, but the analytical ones as well. Third, be sure that you have all the agreements in writing. It's a contract between you and the statistician. The contract also serves as a checklist to make sure that everything is being done. Finally, always ask questions. This is a learning opportunity for you and for the statistician. All questions, whether small or big, are important to ask.